Joining us for this week's Your Health segment is Dr. Jason Ramirez, Assistant Professor at the Department of Family and Community Medicine at the University of Maryland School of Medicine and Director of Inpatient Medicine at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thank you, Jeff.
You were telling me before the program that you have you have named a new medical condition known as Y chromosome syndrome.
I have.
This is going to wind up in a peer-reviewed journal, I'm sure. What's it about?
Well,
I think I may know, but tell us.
Yes, I affectionately call a lot of patients that are men as having the Y chromosome syndrome. Men have an X and a Y chromosome, and having this syndrome myself, I do not like going to physicians, and most men just don't like going to doctors. And I often chuckle still 18 years later when I ask a gentleman, why are you here? And they look over at their significant other who kind of gives them that look like, talk about something because I told you to come here. Men just in general don't like going to the physician.
Well, for one thing, I mean, since, we were little, whenever you went to the physician, you got stuck with a needle for no good reason, it seemed at the time. And maybe it's just not wanting to invite bad news. What do you think?
Yeah, it's interesting. 'Cause I have thought about it a lot, and it is that I think men don't want to hear the worst, and we often think of, okay, I'm going to hear something bad news, and I don't want to hear it, and so we actually, ironically, prolong sometimes our care, and I see that a lot where men will present with more advanced illness and disease because they are not up on their primary care, such as cancer screening, vaccinations, as you put it. And it really does seem like they're not listening to their body, the signs and symptoms that their body may tell them. They may wait months, sometimes years, before they come to a physician, and when they could have caught it earlier, where management could have been taken.
So it could be denial, could be some other things.
I think a fear of the unknown, more so. I see it more so in men. A fear of, well, what is the doctor going to tell me? They're going to give me some news that I don't want to hear, and if I ignore it, it'll go away. You wonder
if Y chromosome syndrome is a contributing factor in women outliving men for the most part. Has that itself, the longevity differential, been studied?
No, it's not been studied in the manner of that. Again, I kind of coined that term.
You made this up half an hour ago. Right?
Yeah, well, coined that term, but I do believe it is relevant. So when men aren't coming to the primary care physician, their family doctor or their primary care physician, and getting their health maintenance screening, they're not getting counseling on proper lifestyles of diet, exercise, smoking cessation, moderation of alcohol, then they do present with later disease.
Let me remind our viewers, if you have a question about men's health that you don't want to make an appointment and go to the doctor to ask, you can call us. The number will be up on the screen. You could also tweet your questions at MPT News is the Twitter address. Please give us a call. Now, some stuff everybody can understand. It's better to find out if you have high cholesterol now than when the heart attack comes. But maybe there's some things where, like prostate cancer screenings, where maybe some men have seen other men have what appear to be bad experiences.
True. I actually hear that a lot. Men will come and they say, I'm not going to get this, I don't want this test because a person had this and these were the outcomes, and I don't want that to happen to me. The point of primary care, however, is to try and address disease or prevent disease before it becomes too far advanced. So your cholesterol screening, your diabetic screening, your high blood pressure screening, those are high risk factors for the most common cause of mortality, which is heart disease.
And the solutions aren't terribly onerous. I mean, you can take a pill, you could lose some weight, whatever it is, and live longer.
Correct. Yep.
So it's a pretty good deal.
Right. With education and lifestyle modification, with the knowledge that you can improve your health, it really is helpful.
Let's take a phone call. Sure. Garrett County, this is Dave. Dave, thank you for the call. Go ahead.
Yeah, I went through 45 treatments of radiation, and they said, oh, it's gone. But they didn't take any pictures or anything. How do we know it's gone?
Thank you, Dave. Thanks very much for the phone call. Guessing that was prostate related or something. What are the current recommendations on that? Because it's been the PSA in particular has been it's been back and forth. Put it that way.
Right. Yeah. You're absolutely right. Recommendations for prostate cancer screening, and as far as PSA has changed over the past decade, where it used to be every man at the age of 50 would get a PSA screen and an examination, to now our role as a primary care physician is to educate on what the test is, what the possibilities are if the test is abnormal, and make what we call informed decision-making on the patient standpoint.
Let's look at this demographically for a second. We'll talk about ages in a second, but for African-American men, men of Latino descent, are there any special concerns that you would want the primary care physician to ask or raise?
Absolutely. It definitely plays a role. So family history, African-American heritage would put people at higher risk of prostate cancer, and that's part of the informed decision-making. If I have a gentleman who comes in and says, my father and my grandfather had prostate cancer, I'm worried about it, I'm more likely to go ahead and say, well, you know what, let's get this test, the PSA test, with the education of what it means if the test comes back abnormal and what the further steps would be.
You know, I was starting to think about the difference in men's ages, and I was going to ask a question about guys in their 20s, and they think they're invincible, and they're not really enthusiastic about going to the doctor unless something's bleeding. But then it occurred to me that we all think we're in our 20s. I think guys up until their 80s think they're in their 20s, and maybe that's part of this.
That's a good point. I never thought of it that way. That definitely, when young men are in their 20s, 30s, they don't think they have health problems. They don't appreciate the consequences of some of the lifestyle choices they've made. I do think when we get a little bit older and more experienced in life, it becomes more of, okay, I'm worried about what I'm going to find out because of my lifestyle changes that I made in life, or decisions I made in life. Yeah,
here's a Twitter question. I just turned 40. What health screenings would you recommend, and how often?
Okay, good question. A lot of it depends on risk factors in life as well. So diabetic screening, high blood pressure screening, and cholesterol screening, again, targeting the main risk factors for coronary artery disease or heart disease. If someone has again, family history of certain illnesses, that may trigger me to think about those as well. But at 40, that's really the screening recommendations. There are more screening recommendations once a gentleman turns 50.
I was joking earlier about, you know, getting shots every time he went to the doctor as a kid, but as we age, do we continue to need any routine stuff?
Yeah. Tetanus is usually the one that we miss a lot as adults. We don't think we need a tetanus booster anymore, but every 10 years we should be getting tetanus, and it's a tetanus pertussis combination. And the pertussis is an illness that really affects children more, but by us getting immunized as adults, we're actually protecting our young children or grandchildren that maybe not had the immunizations yet. So whereas these illnesses may not do much in adults, they can be very serious in young people.
What do you do with a patient who has no idea of their immunization history when they were a kid? Does it matter later in life?
It can. For instance, somebody who was not sure if they had chickenpox is at risk for shingles. You know, back even when I was growing up, the chickenpox vaccine didn't exist. We don't see as much of that anymore. But what's important with the immunizations is that people know what they've been exposed to, and you can do that with blood titers. So you can get blood tests to determine if you have immunity to things that you should have been immunized to as a child.
And then the annual question of flu shots.
Yes, flu shots. So
you get a flu shot, I'm guessing.
It's required that all healthcare providers get a flu shot, and it's always debatable because I get I'm going to get the flu from the flu shot, or you know, the flu shot got me sick. Most of the time, it's the flu vaccine just didn't cover the strain of flu that we covered during the immunization.
Let's grab a quick phone call here. Washington, D.C., this is Isaiah. Thank you for the call. Go ahead.
Yes.
You're on.
My question is,
I've been diagnosed with cancer in the prostate, and so I'm not sure whether I should have the entire thing taken out or I should have isotopes.
Isaiah, I really hate to cut you off. I've got like 30 seconds left in the show. We'll get you an answer on the air, and best of luck. He needs a urologist for that.
Correct.
And where do you, little advice on finding a good specialist in a situation like his?
Well, you go to your primary care physician, and they would have the resources to refer you to the proper specialist.
Very good. Jason Ramirez is with the University of Maryland Medical Center. Doctor, thank you very much.
Thank you very much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.